As temperature increases, there is an urgent need to co-design interventions to reduce the impact of extreme heat exposure on pregnant women and their neonates. In Kenya, the Climate Heat Maternal and Neonatal Health Africa CHAMNHA consortium through the Aga Khan University has been working with community members in rural Kilifi to understand the effect of high ambient temperatures on maternal health, as well as to co-design with the community members to identify priority interventions. Please watch our video story that summarizes CHAMNHA research findings at
After findings from our formative qualitative work, it was imperative that we bring all the key stakeholders on the table so that they can begin to deliberate on the key priority interventions. The key stakeholders for our co-design workshop included pregnant and postpartum women and their support networks, who are mothers-in-law and male spouses. We also included the key influencers that work with women on a daily basis. For example, we had community health volunteers, community health extension workers, religious leaders, and government administrative chiefs. Our findings indicated that different policies from different ministries are required in order to reduce the adverse effect of heat exposure on maternal health. We therefore invited representatives from varied ministries such as Ministry of Water, Agriculture, Meteorology, Education, Gender, Sanitation, Housing.
Our co-design workshop identified priority areas that are linked to each other, underscoring the need of multi-sectoral networking and collaboration. The priority intervention areas include improving water sources and systems, adapting the health facilities and home environment to reduce heat effects, greening the environment, improving early weather warning information systems, behavior change interventions. CHAMNHA researchers further refined the priority areas for interventions in a consultative panel discussion with key policymakers from various ministries in a separate meeting. Our research found that there is no water and cooling spaces in many health facilities and indoor temperature is high. High indoor temperatures interact with a high staff-patient ratio, compromising the quality of care. Since many health facilities are far from their homes, many women miss antenatal and postnatal care for the fear of walking in the heat.
Currently, we are experiencing a lot of perinatal mortalities in Kilifi County. We can attribute some of those mortalities to heat. So the suggestions to reduce these mortalities, to ensure that we create 35 cold maternity areas. And then apart from that, healthcare providers need to be trained on the effects of heat for both the pregnant woman and the baby.
High temperatures in Kilifi interact with an extended period of drought affecting water sources. Water sources have dried and the available sources are far and contaminated, implying that pregnant women must trek for more than 5 kilometers to fetch water. This compromises mothers' personal and home hygiene. Mothers also refrain from drinking contaminated water, dehydrating them and their neonates.
A policy directive should be put in place to ensure that all the health facilities have gutters, have water tank to harvest the rain, and that then will translate to these other issues we are trying to address, because we are emphasizing on how to make that environment conducive and more healthy even for the dispensary.
Heat exposure in direct pathways through the built environment is harmful to both the mother and the newborn. Houses are made of low-lying roofs, are small, and have no windows. Indoor heat in these houses is unbearable because the homes are used for cooking, sleeping, and relaxing. Breastfeeding and the use of mosquito nets are challenging due to the discomfort caused by the heat, indoor smoke from cooking, and dust. The homes also lack shading. The community and policymakers suggested revising structural design policies to include features responsive to hotter climates, such as houses with higher wall heights, improved ventilation spaces, elevated roofs, and conducting research into alternative cooking methods to reduce indoor smoke. Most trees are cut for lumbering, charcoal selling, and firewood. A policy is required to regulate these. Suggestions for improvement from the co-design participants include empowering communities with civic education on greening homes, encouraging communities to plant fast-growing trees for firewood, growing drought-resistant indigenous trees with multiple benefits such as medicinal and fruit trees, and providing school children with drought-resistant trees and seedlings to plant.
Why don't we then have a policy in place that the environment department can work hand in hand with those enforcement officers? Then we have these people charged in court so that we stop that charcoal burning.
Kwamba tuweze kupata maofficers ambao wataweza kuelimisha na kuendeleza agroforest.
CHAMNHA researchers observed that an early weather warning system that can alert pregnant and postpartum mothers about upcoming drought and extreme temperatures could help them and their communities plan to protect themselves from the sweltering heat. The available weather warning information on the radio and television is sometimes inaccurate, and many residents do not seek weather information, in part because the information is provided in English. Many rural residents in Kilifi depend on indigenous information weather communication strategies passed on from different generations, such as rainmakers and observing clouds.
Mabata pia utaona yanapiga hivi, basi ule umeme ukianza tunajua mvua iko tayari. Hizi ng'ombe unaziona zinaweza kuondoka mbio. Naona inasimamisha ule mkia wake. Basi sio peke yake, nyingi zenyewe kabisa zote inaenda huku inaenda huku. Unajua mambo yako tayari.
But as we face this particular session of climate change, we want to revert back to our systems which were very perfect, were quite predictable, and they were very simple.
In addition, policymakers and community members emphasized the need to improve the delivery of early weather warning message in local languages, as well as capacity building the community health volunteers, chiefs, and other community leaders to assist in delivering timely messages in schools, churches, mosques, and communities. There is massive crop failure in Kilifi, and pregnant and postpartum mothers do not eat enough. Food prices are high, and low birth weight babies have increased. Community members linked food insecurity in these communities to low milk production among postpartum mothers, which is seen as influencing their ability to perform exclusive breastfeeding. CODSIGN participants underscored the need for more research to inform drought-resistant food crops and a policy to support pregnant and postpartum women with the provision of nutritious food. The priority interventions from the CODSIGN workshop that the CHAMNHA researchers piloted was a behavior change interventions. Some of the cultural practices that researchers found that are harmful to mothers and their newborns are: many women continue to work with babies in the heat and perform heavy workload immediately after birth. This harms the baby's skin and leads to hemorrhage in the mother. The communities lack knowledge of the dangers of exposure. Babies are layered in many clothes due to the fear of being harmed by witchcraft, which may lead to dehydration. Some pregnant and postpartum women do not drink enough water because they fear contaminated water can freeze breast milk, or water from dirty and contaminated sources will harm their unborn child.
We piloted our interventions with a cohort of 30 family members. Our aim was to use a system approach to mobilize this community so that they can learn about the dangers of heat, as well as to be keen to support pregnant and postpartum women with heavy workload in periods of high temperatures.
We use community health workers to sensitize and educate the community members.
Tunapopata mama mjamzito huwa tunamsisitiza kunywa maji ya kutosha, tena ambayo ameyachemsha, ili kwamba yakaweze kuwa salama katika afya ya mwanadamu.
We also educated women and the dangers of heat exposure, the importance of drinking water, breastfeeding frequently, task shifting, and attending antenatal and postnatal clinics early in the morning when it is not hot.
Joto ni hatari sana. Hakikisha umechemsha maji ya kunywa na ukunywe maji mengi, na unamnyonyesha mtoto wako mara kwa mara. Halafu hakikisha kwamba usitembee na mtoto wako wakati wa joto jingi kwenye jua huku nje. Kaa kivulini na fanya kazi zako wakati jua limetulia ama asubuhi na mapema.
Towards the end of our interventions, we got reports from the community members that there was now increased awareness of the dangers of heat exposure, and also researchers observed a positive response from the rest of the community in supporting women in periods of high temperatures. In addition, even families that were not part of the interventions, the CHVs reached out to them to educate them more on the heat dangers. So in a nutshell, we felt the impact was massive. The GIFs disseminated our meetings, and the CHV actually included the heat danger messages in their daily work.
Central to our interventions was having local chiefs make a public pledge to support our project and reach out to other male spouses in the community to support pregnant and postpartum women.
Kutoka siku Mavia na mume wangu walihudhuria mafundisho ya Aga Khan, Mavia yangu amekuwa akirauka kunisaidia kuchota maji kabla aende kwa biashara zake. Naye mume wangu hurauka anachemsha maji kwa ajili ya familia.
Elimu hii ilikuwa ya manufaa sana kwetu sisi madaktari wa nyanjani. Sasa tuna ujumbe wa hatari ya joto jingi katika kazi zetu za kila siku, na tunaendelea kupeana huu ujumbe kwa jamii yetu.
Nachemsha maji na nanywa mara kwa mara, na namnyonyesha mtoto mara kwa mara ili tusipukiwe na maji mwilini.
Some male spouses reported facing cultural challenges performing feminized roles.
Hili shirika la Aga Khan walituletea mafunzo mazuri, lakini kwa sababu ya jamii ambayo bado inapenda kuhamasishwa, walinichukulia vibaya kwa sababu mimi nilikuwa mara kwa mara namsaidia mke wangu kwa kuchota maji, kwa kumtafutia kuni, hata kufua nguo wakati yeye ana shughuli nyingine. Sasa hawakuchukua vizuri vile, mara kwa mara walikuwa wanasema mimi nimekaliwa na mke wangu na vitu kama hizo.
The CHAMNHA interventions, although piloted with a small cohort, revealed the need to scale up such interventions in rural African setting to sensitize and educate the communities on the dangers of heat exposure. Funding is needed to continue with this work in these settings and other similar settings in sub-Saharan Africa. We acknowledge the Belmont Forum for funding this work. We would also like to acknowledge all the research participants and all stakeholders, including Kilifi policymakers and all CHAMNHA Kenya researchers.